Today I'll be going over some of the words or vocabulary that you may encounter while taking the HESI A2 exam. The first word is abstain. So the bottom image is a good representation of the word abstain means. So it could be voluntary withholding or stopping oneself from doing something. So you can think of the bottom image saying stop to help you kind of remember what the word abstain means. So you're voluntarily stopping or withholding yourself from doing something. The next word is accountable. So you can think of responsibility or to be responsible. And if you can't remember, you can think of the image on the left top corner of taking care of a plant. You have to be responsible or you have to be accountable for watering it and making sure it gets enough sunlight to grow. Next is the word acute. So you can think of these three images. If someone has chest pain, it could be that their pain is acute, that it was intense or sudden. Again, the word acute means to be intense or sudden. Next is the word adhere. So you can think of a bandage, which is sticks to your skin. So adhering could be to stick together. The next word is adverse. This could be possibly harmful or undesired. So you can have adverse effects. So you can think of the skull at the bottom, which shows that you can think of that it's harmful, or adverse, that it is unwanted. So the right images show that they're having adverse reactions or adverse effects. The next word is ambivalent. Ambivalent is having uncertain or contradictory feelings. So the three images on the bottom and on the right side, you can see that everybody's thinking they're unsure, or even the top left image is showing that they're unsure. It also looks like they're worried, but think of the word uncertain when you see the word ambivalent. Personally, this was a word that I saw while taking the exam. Next is the word ambulate. So you can think of to walk. This means simply to walk. So you can think of these words where someone is having to walk around the unit that they're on while they're in the hospital, or just simply think of the word walk. The next word is apply. So this can mean to spread something. So you're applying either sunscreen or someone is applying a Band-Aid. The next word is assent. So this means to agree or to give consent. So this is a little bit of an easier one because think of assent almost sounds like consent, or it starts with an A and you can remember agree. Agree starts with an A, so does assent. But if you ever are stuck, just remember assent, consent, you're agreeing or you're saying yes to something. You can see the thumbs up right here on the word agree. Another way to remember is many times when you're in the hospital, you have to sign consent forms or forms that you're agreeing to and saying that you are consenting to whatever is going to be done or the procedures. Next word is audible. So you can think of the app Audible. It's hearing, you're listening to books, or you can think of a stethoscope. You have to be able to hear, or you can think of an ear, but I feel like the easiest way to think of is audible books. You're listening to books, so audible is to hear. The next word is bacteria. So this is a microscopic organism. It's single-celled. So you can think of, you have to be able to see bacteria, you have to look at it through a microscope. So the left top corner, you can think of single-celled, or you can think of that image, or microscopic. The next word is bilateral. So you can think of bi equals two. So lateral means on the sides. So if it's bilateral, it means it's on both sides. So you can think of on the sides right here, or the lungs are bilateral. They're on both sides. The next word is cardiac. So this is in relation to the heart. Cardiac, so cardiac tissue or cardio, it's related to the heart. The next word is cavity. So this is an empty area, empty space. So you can think of when you have a cavity, it's like an empty hole or it's something that is bothering you. But here are two images that kind of define a cavity or show what a cavity is. So you have a visual image. The next word is cease. So this is to bring to an end or to come to an end. So you can think of a finish line, stop, that the vehicle came to an end, or something flatline is ceased. The next word is chronic. So you can think of long-lasting or reoccurring over time. So when you see this, you can think reoccurring, and then you see the little thing with the sand. It could be reoccurring or just over a long period of time. That is chronic. Another way you could also think of is chronic illnesses. So it could be that it is a disease or that it's just long lasting. The next word is chronology. So think of timelines or order of events. So right here you see 2017, 18, 19, 20, 21, 22, and so on. So just think of the word timeline when it comes to chronology. So you can think of chronological order. It is in order. The next word is compensatory. So you can think of making up for something. So if there is an accident at work, or you can think of workers' comp, or worker gets compensation for being injured on the job. So think of making up for something. They're making up, or they're being paid that loss for being injured. But in overall, just think of making up for something. When you're thinking, you see the word compensatory, you're compensating for something. The next word is concave. So think of rounded inward. Here are different ways you can think of the word concave. When it comes to the HESI, it's going to be a little bit more focused on specific things, like for nursing, but you can use these other images to help you remember concave. Okay, if you wear contacts, the lens is concave, it's rounded inward. Or you can think of your back, it's also rounded inward. Or the pillow on the bottom, where it is rounded, but it's inward. So think of different ways to memorize these words, or just for you to remember when you are in the situation while taking the exam. So again, concave is rounded inward. Whatever helps you, if it's the context or it's the back or the pillow, as long as you can remember if you do encounter it while taking the test. The next word is concise. So you can think of as brief, short, or to the point. So these are some of the images I felt helped me remember. It's concise, it's short, and straight to the point. So what is straight to the point? A summary. So it's concise and it's brief. You can use other words to help you remember or other images, but think of summary when you think of concise. The next word is congenital. So this means to be present at birth. So when someone has a congenital heart defect, this was something that they had when they were born. So you can think of these images right here is at birth. It was present at birth. The next word is consistency. So this can be how thick or thin something is in relation to a fluid. So you can think of that the right side over here, the liquid is a little bit more thinner, or on the left side that it is a little bit thicker. Again, this is consistency. Something I do want to point out is that try to see what the word means when you're reading the sentence, because when I saw this word, it was consistency. I was like, oh, okay, something that is constant, you're consistently doing something. But make sure you read the sentence and see if its consistency, which kind of word, the way the word is being used in the sentence. So if it's consistency of thickness or how thin something is in regards to a liquid, or is it consistency something is consistent. The next word is constrict. So this means to come together, to become smaller. So when plaque grows or builds up in your arteries, it tends to constrict or become smaller, which can cause blood clots, as you can see right here on the image. That middle area is becoming constricted, becoming smaller. So this other image on the right may help, because think of it's becoming smaller. You're making that motion with your fingers. Or you can just think of this artery right here when plaque builds up. So again, the word constrict means to become smaller. The next word is contingent. So the word contingent means to depend. So these were the most similar images I could find. So if you can see something similar both these images have, is that the top part depends on the next area. So right here, the area is going here. So you can think of this person is depending on the top person to get something done, and so on. Same here. It's dependent on something. Same with a house. If it's being sold, it's contingent on the buyer making sure they have the funds to purchase the property. So again, contingent means to depend or dependent. The next word is contraindication. So this is a reason something should not be done or it's not advisable. So this was one of the images I found that helped define this word, is that maybe you should not eat while taking this medication, or just specifically eat something acidic, because it may affect something while you're taking the medication. So here's a pharmacist explaining the possible contraindications of taking this medication. So you could just think of a reason something should not be done or is not advisable to do. The next word is convulsive. So this is convulsions or violently shaking. So you can think of if someone is having a seizure, they're having convulsions, and they're violently shaking uncontrollably. So the word convulsive is, think of the word shaking or violently shaking of the body. The next word is cursory. So think of quick, cursory exam. So you can think of going to the optometrist. Usually these exams tend to be quick. They're cursory. So think of anything that may be quick, an exam. So when you encounter this word, think of the word quick. Next, the word defecate. So these images, I feel, do a good representation of explaining what the word defecate means. So this means to expel feces. So it could be the dog defecated, or just explaining that someone passed stool. So you can think of these images, or remember that is what the word defecate means, which means to expel feces. The next word is deficit. When you think of this word, think of lack. So you can see the arrows pointing down. There's a lack of vitamins. There's a shortage. Here's another image to help define the word. Again, the word deficit means to lack something, or there's a deficiency. The next word is depress. So you can think of press downward. So you can think of the pedal, or down begins with the letter D, and then press sits in the word. Depress, to press downward. The next word is depth. So this is downward movement from a surface. So this is, these are two images that help explain. So it's the depth of something. So the depth of a pool. So just from the surface down, the measurement of that. The next word is deteriorating. So this means to get worse. So these are two images that help explain the word deteriorating. So it could be that the roof is getting worse. This wheel right here is definitely deteriorating. So think of to get worse for this word. The next word is diagnosis. So it says identification of an injury or disease. So you can see the doctor is explaining to the patient their diagnosis. Again, so it is them explaining or identifying their injury or disease. The next word is diffuse. So you can think of this image right here where it starts here and it gets smaller. It gets bigger, sorry. So it is being spread or generalized. Think of the word generalized. So it's a whole bunch of things or just a large area. So we have here to spread over a large area. So you can think of it started small and then the rash diffused. It spread into a larger area. You can think of a diffuser. It's generalized. It's being spread throughout the air. The next word is dilate. So this is to expand, get bigger, or enlarge. So here are two different examples of the word dilate. So the first one at the top on the left side is that when you go to the optometrist, they dilate your eyes sometimes. So it's to help your pupil enlarge so they can see the back of your eye. So that's dilating your eye. When a woman is pregnant, they have to dilate in order for their baby to come out. So you can think of to expand or to become larger. The next word is dilute. So this means to become less concentrated. It could be because you add water. I feel like this right bottom image is a good example. So it's really concentrated right here, and as you go down, it becomes more diluted. Okay, the next word is discrete. So this means distinct or separate. So you can think of almost like not a secret, but it's in a different area. It's not obviously shown, or it's somewhere where you cannot see. The next word is distal. So this means away from the center of the body. So it is distant. So you can think of distal, distant, or you can think of these extremities right here. The legs, the arms, the hands are away from the center of the body. The next word is distended. So you can see this word, think of expanded or enlarged due to pressure. So you can think of here, the arrows are pointing out, it's enlarging. So distended means enlarging due to pressure. The next word is dysfunction. So this can mean abnormal function. So you can think function is right here. So you can think of the first part of the word means abnormal. So abnormal function. The next word is empathy. So this means you are able to share your feelings or sympathize with other people. So you can think this is a good image. She's consoling her. She's showing empathy. So you can think of these images. Also, if it's easier, think of empathy, sympathy. You're able to understand another one's feelings. Equilibrium. So you can think of balance. If you see the word equilibrium, try to remember balance. These images, you can also try to remember. There's trying to keep in balance. This has equilibrium, and this is trying to, or this, well, it actually is here. So think of equilibrium, equal, or think of balance. The next word is etiology. So this one is the cause or origin of a disease or a condition. So think of the cell, or just think of origin of a disease. The next word is exacerbate. So you can try to remember the images, try to find something where you can remember. But this word means to get worse or more severe. So you can think of, if it helps you go in this order right here, or it's they're a little tired, or it goes on here. And then at this point, it's just at the worst it can be, it's severe. So think of worsening or it to be extremely severe. The next word is exposure. So this means to come in contact. So you can think of exposure to the sun, or you can become exposed to diseases, viruses going on, or you can think of COVID. People got exposed to COVID and they got sick, and we had to wear face masks to help prevent as much exposure. So try to remember exposed, come in contact. So again, the word exposure means to come in contact with. Next word is extension. So this means to lengthen or unbend a joint. So you can think of this image, or extend, you're extending your arm, or if this is easier, doing these workouts, they help extend this area. So extension, lengthening, think of an extension cord, it's helping you plug in something that's shorter. So think of just lengthening, extension, extending your arm. The next word is fatal. So you can think of death or deadly, or you can even think of these images. So fatal is resulting in death. The next word is fatigue. So this means exhaustion or tiredness, extreme tiredness. So these two images I felt were a good representation of what the word fatigue means. So think of tired, I'm fatigued. The next word is febrile. So this means fever. So relating to a fever, so you can even try to remember, it starts with an F, fever, febrile, or in Spanish it's fiebre. So if that helps you remember, just kind of try to find ways to remember the word. And again, pay attention to the way it's used in the sentence. So febrile means in relation to a fever. Next word is flexion. So flexion means bending of a joint. So this is the opposite of the extension. So flexion, you can think of flexible. So here she's pretty flexible. He's pretty flexible. So you can think of that they're bending. They have to bend. Here you're flexing. They're flexing their arm. Or here they're also bending their joints right here. So you just think of flexion. If it helps flexible, I think of shortening or bending a joint. The next word is flushed. So these emojis are pretty good at explaining what the word flushed means. So already redden appearance, that someone becomes flushed, their cheeks get red, or when someone gets embarrassed, they become flushed. So think of the word flushed, or even blush if that helps. They become blushed, it looks like they have blush on. So flushed is a reddened appearance. Next word is gastrointestinal. So this is in relation to the stomach and intestines. So this one's a little bit more easier to identify while looking at the word. So intestinal, the intestines. Okay, we have that down. And then stomach. So think of your gastro system. So stomach and intestines. So in relation to the stomach and intestines, that is gastrointestinal. Next word is hematologic. So this is relating to the blood. So you can think of blood vessels or just blood in general. So if you see this word, think of blood. Anything to do with blood. So again, remember to read the sentence. If you see the word hematologic, it is in relation to blood. The next word is hydration. So this is maintaining enough fluid and balance in your body. So hydration, think of water. You want to maintain a certain amount of water. If not, we'll become dehydrated, which is with the lack of water. So think of hydration, water, or just think of enough fluid and balance within your body. So hydration in relation to blood. In relation to water. The next word is hygiene. So this is the measurement of cleanliness and good health. So you can think of hygiene can be multiple things. Hand washing is a good form of hygiene. Taking a bath or shower is another good form of hygiene, and brushing your teeth and just maintaining your dental hygiene. So think a lot of things are, you can think of different ways to remember the word hygiene. So dental hygiene, and there has to be good hygiene in the hospitals. You have to wash your hands, so that is, again, good hygiene. Hygiene, the way you contribute to cleanliness and good health. Next word is impaired. So this means a lack of quality. So when someone's visually impaired, they have a lack of vision, or they are impaired with their hearing, so they cannot hear very well. So impaired is a lack of quality of something. The next word is impending. So this word I liked because you can see it has the word pending, which is part of the definition. So in the near future or about to happen. So this one, something is loading, it's impending, it's about to happen, or it will occur in the near future. So if you see this word impending, just remember that it has the word pending in it. So what does pending mean? It's about to happen, you're waiting on something to load, possibly. Again, the word pending. Next word is impervious. So you can think of something that is waterproof. So there's a barrier, it's not allowing it to pass through, or impenetrable. So you can see these two at the top. The water is going away from the bottom. You can think of this sign, or you can think of waterproof. It's impervious because the water is not going through the pans. So it is impenetrable. If you can remember that word as well, impervious, that it is not allowing, there's a barrier. The word imply. So this is to not directly state something. So they have on here to suggest without explicitly stating. Incident. So this means to occur. So if there's an incident, it's something occurred. Or if you have to write an incident report, you have to report what happened, what occurred. Someone fell many times in the workplace, you have to report that incident. Next word is infection. So this means contamination or invasion of the body. So you can think of this image right here, or if someone gets an infection, you can just think of here. These images or other images, just remember, infection means contamination or invasion of the body by pathogenic organisms. Next word is infer. So this means to conclude. You can think of this. They're inferring what may happen next year, or the statistics that will that potentially they could see. Next word is inflamed. So you can think of redden appearance, something that's warm or swollen or tender. So right here, the ingrown toenail is inflamed, or their gums are inflamed, or they're inflamed right here. Think of inflamed, think of red, swollen, warm. Or you can even think of flame. Flame is red, hot. So you can try to remember that in case you encounter this word during the HESI exam. The next word is ingest. So this means in relation to digestion. So they're swallowing. So you can think of ingest is to swallow for digestion. So ingest, digestion. So you can think of eating, swallowing, or consuming something. The next word is initiate. So this means to begin or to start something. You can think of a start line, or you're initiating a conversation, you're starting a conversation with someone. So you can think of the word beginning or start when you encounter the word initiate. The next word is insidious. So this word, you can try to remember through this image, or you can try to remember through the movie Insidious if you've seen it. So we have here something that's gradual and that does not become apparent for a while, so a long time. So you can think of when you're watching the movie, something's about to pop up, but you don't know when, and then all of a sudden it comes out. So you can think of the word insidious. So we have here so gradual as to not become apparent for a long time. So you can think of this image or that definition when you see the word insidious. Next word is intact. So this means together, in place, or unharmed. You can think of these three images. Everything is intact. The puzzles are intact. Nothing is missing, pulled apart. Everything is in its place. It's complete. The pizza, it's intact. That helps you remember, but these puzzle pieces are all intact. They're together, they're in place, and they are complete. Next word is intubate. So this means to put a tube into something, and something you may be able to remember is when you intubate someone. So a tube is inserted into their esophagus. Many times, if you've seen many shows, many health shows, they say they need to intubate. So you can think of that if that helps you remember. So think of a tube being inserted. Next word is invasion. So this means to enter the body part. To enter the body part. So you can think of here, there's an invasive procedure, which means they have to go in to the body. Next word is kinetic. So this is relating to movement. So you can think of energy, kinetic energy. It's in relation to movement, the basketball, batteries. If it helps you remember energy, just movement, just think of kinetic is in relation to movement. Next word is label. This is to change quickly or rapidly. So you can think of this image right here. Some moods change from happy to sad to angry. It's changing rapidly and often. Next word is laceration. So this means a tear or a cut. You can see there's a laceration on their hand, on their foot, or on their chest. You can think of laceration as a cut. Next word is latent. So this means to not be active or visible. So this is not visible down here. That's part of the iceberg. Or the lava here, it's not active, but it's here, but you cannot see it. It's present. The lava is present, but it's not active nor visible. Lateral. So this means on the side. Remember the word bilateral on both sides? Think of lateral, on the side. Next word is lethargic. So this means difficult to arouse. So you can think of this, or even this. They're extremely. It almost looks tired. So they're just difficult to arouse. So this is also similar to the previous word we covered earlier. Next word is manifestation. So this means an indication or a sign of a condition. So weight loss can be an indication or a manifestation or a sign of something else is going on. Again, manifestation means an indication or a sign of a condition. Next word is musculoskeletal system. Is a way you can also remember the word. So muscle right here and skeletal. So try breaking down the word if you do encounter this. All right, neurologic. Think of the brain, or if you can remember neural. So neurologic means relating to the nervous system. This is another good word, neurovascular. So this is relating to the nervous system and the blood vessels. So remember neural, nervous system, vascular, think of blood vessels. Next word is nutrient. So this can be an ingredient that helps with nourishment. Think of nourishment, nutrient. Okay, the word occluded. Think of occur. Occluded, occur. Or you can think of to close or to be obstructed. Next word is ongoing. So this means continuous. Think of the word continuous if you see ongoing. It's continuing, ongoing, or continuous. Next word is oral. So you can think of when you go to the dentist, you're going to get an oral exam. So you're checking your mouth. Think of oral, something that is relating to the mouth. Next word is otic. So this is in relation to the ear. This is the ear area. Remember, otic, ear. Next word is parameters. So think of limiting factors. So you can think of here, that can only go so far back or so forward, or right here. You can think of even like a DJ area. There's limitations to those. So think of parameter as something that is, there's a limit, there's a limiting factor. Next word is patent. So you can think of open. You see the word patent, try to replace it with the word open. Next word is pathogenic. So this is the causing of a disease. So think of a disease that's causing them to become sick. So think of causing or able to cause a disease, pathogenic. Pathology. So think of the word abnormality. So you can think of, they have to look up something that's abnormal. So process, causes, or effects of a disease. Remember, we just went over the word pathogenic, which is the cause of a disease, or it's able to cause a disease. Now think of pathology. Something is abnormal, it's causing a disease. Posterior. Posterior means back. So think of someone's back or just behind. So again, the word posterior means located in the back or behind. The word potent. Think of strong. Something is potent. It is producing a strong effect. So I felt like this image was a good representation. You can see here that their smell is potent. It is strong. It is producing a strong effect. So potent, strong. Think of that. There is a strong effect. All right, next word is potential. So think of capable or it is its ability to happen, or its likely ability to happen. Again, the word potential means capable of occurring or likely to happen. Next word is precaution. So this means preventative measures. So you can think of, you want to be precautious, you want to wear your face mask, or making sure you have good hygiene, washing your hands, wearing gloves, taking precaution, taking preventative measures. Or you can even remember it has the word caution and the word preventative measures. So precaution. Next word is precipitous. So you can think of this as something that's extremely uncontrollable and rapid. So you can think of here, it's out of control. This image is a good image. It's out of control and the water is coming out rapid. Same here, out of control, and the flames are increasing rapidly. When you see the word predisposed, think of susceptible. I just memorized this word, susceptible. I tried to replace the word with the word susceptible, and that helped me. This is definitely a word that I saw while taking the exam. So this is to be more susceptible to something. So when COVID came out, elderly individuals or children were more predisposed to the virus. They were more susceptible to getting it because of their immune system. So think of susceptible when you think or see the word predispose. Next word is pre-existing. So you can think of already existing, already present. Again, look at the word pre, before, it was there before, or existing, it was already there. So individuals too that had pre-existing diseases, they were also more predisposed to COVID. So you can think of pre-existing, it was already there. Next word is primary. So this means most significant, most important, or first, primary. You can think of someone that's a primary doctor. You go to them first, or the primary holder of something. They're the first individual, first person. So just think of primary, first. Next word is priority. So you can think of important, something that is very important. Try to remember these images if it helps, but it needs attention right away. It is your priority, and it's extremely important. Prognosis. So think of it is the foreseeable outcome, the result. What is anticipated or expected? That is another way to remember prognosis. What is expected to be the outcome. Rationale. Think of reason, R, rational. Rationale is the underlying reason. So if you can remember this slide, think of, okay, this word was underlined. The underlying reason of something. Again, rationale is underlying reason. Next word is reoccur. This means to happen again. So almost like the loading sign. Continuous. It will reoccur or happen again. So think of this symbol right here. It's continuous. It keeps on moving. It's going to keep happening. So something keeps reoccurring. Next word is renal. When you think of the word renal, think of kidneys. So this is relating to your kidneys. Try to remember. So renal gland, anything that'll help you remember that renal equals kidneys, okay? Next, the word is residual. So think of remaining, another R word. Residual is remaining. You can think of residual volume. So when you breathe out, the residual oxygen that's left in your lungs is the residual volume. Think of the word remaining if you ever encounter this word. You can even try replacing the word to help you understand what they're trying to ask you. Next word is respiration. So this means to inhale or exhale air. So you're whatever you're breathing in and you're breathing out. You're think of respiratory system, respiration, anything that helps you remember in relation to inhalation and exhalation of air. Next word is retain. If you see the word retain, think of withhold. So you can think of retaining fluid. So you can think here, many pregnant women, they retain more water, more fluid, so their legs tend to swell or their feet swell because they retain a lot of fluid. So you can try to remember these images, fluid right here, and see if you can remember that. So think of retain to withhold. The next word is status. This means the state or condition. So you can think of someone asking the nurse, what is the patient's status? So what is their state? What is their condition? How are they doing? So you can see they are reporting, they're explaining the status of the individual behind them. Next word is subcutaneous. Subcutaneous. So this means underneath the skin. You see here, they're placing the injection in the subcutaneous area, so underneath the skin. Next word is sublingual. So we see the word sub again. So think of underneath. You can think of this area right here. It's sublingual, underneath the tongue. Next word is supplement. So this means to take in addition to. So you can take vitamins to supplement your diet, to add to your diet. So this is to help a lot of vitamins or supplements. And try to think of here. And think of in addition to. Next word is suppress. So to stop something. Okay, you can think of the fire extinguisher is suppressing the fire. It is trying to stop the fire. So this person isn't letting this stop them from going over. So think of suppress, to stop. Next word is symmetric. So think of the word symmetrical, but symmetric means even on both sides. So all these images, they have the same thing on both, on the left and the right side. So again, think of the word symmetrical when you see the word symmetric. You can see they have very similar beginnings. So practice that and even try to use these images or other images that you can use to remember. Next word is symptom. So think of an indication of a problem. When you start feeling like you have a sore throat, that could be a symptom. Then you may be getting a cold or something that is a symptom. So you can see here, they're getting a fever, they're coughing, they're having chest pain. A symptom is an indication or a sign of a problem or an issue. The next word is syndrome. So this is a group of symptoms that reflect or show a specific disease or disorder. So if you can remember PCOS, that is PCOS is polycystic ovarian syndrome. So there are different symptoms that occur that cause this syndrome. Next word is therapeutic. This means relating to treatment of a disease or a disorder. So think of therapy when you see this. So you can think of occupational therapy. You can think of going to a therapist. Different mental diseases, disorders. So you can think of, if you can remember therapeutic in relation to therapy, if that helps, by relating to treatment of a disease or a disorder. The next word is toxic. So this is poisonous or harmful. Try thinking if you can remember poison is toxic, it's extremely harmful. You can think of these hazardous sign warning you that something is toxic. Next word is transdermal. So this is the crossing of the skin. Almost similar to subcutaneous. This is another similar word that it's transdermal. So this is crossing through the skin. If you can remember, dermal is the skin. So you can think of crossing through the skin. Okay, next word is transmission. So you can think of to transfer, it's another T word. Transmission means to transfer a disease from another person, from one person to another. Now, it doesn't have to necessarily be a disease, but just think of the word transfer when you see the word transmission. So from one person to another. Next word is trauma. So this can be an injury or a wound. This is not such a clear image of the word, but if it helps you remember trauma, you can think of emotional trauma, but trauma can also be that there is trauma to a certain area of someone's body. So you can think of injury or wound. If this helps you connect that to that definition, or try to find another image that will help you remember trauma, that's a wound or injury. The next word is triage. So you can think of many nurses go into triage when there's a huge emergency. So order of urgency or priority. So we see the word priority again. So importance. So if the individual in the middle needs the most help, they're the most urgent person to help, they're going to triage, and that is the order of urgency. Next word is ubiquitous. So you can think of everywhere, present, or found everywhere. So you see this word, think of everywhere. Next word is urinate. So you can think of the word urine. So it's in relation to urine. Or you can remember that it's to excrete or expel urine. So if you can remember the word urinate, to urinate is to expel urine. So think of urine if you see the word urinate. Next word is vascular. So remember, vascular means in relation to blood vessels. Next word is virulent. So this means extremely violent or harmful or severe. So I put this tornado here because they can be extremely violent. So if you can remember that the V word, so virulent, means extremely harmful or severe. Next word is virus. So this is microscopic cells that are usually causing a disease. So think of these right here, virus, think of a disease, something that is microscopically and infectious. Next word is vital. So think of essential when you think of this word, or very important. So sunlight is essential to our daily lives. Or healthcare workers are vital. They're important in the healthcare field. Think of essential. Vital means essential. Next word is volume. So think of the amount of space a liquid is taking up, the volume of the water inside of the cylinder. So remember, volume, think of liquid and space. The space a liquid is taking up. Reread the sentence if it helps, and try to see what the sentence is trying to tell you. And that's it. You got this. Repeat these words. Use whatever you can to help you remember the definition of the word. Whatever works for you. Everybody learns differently. Remember, the HESI A2 exam is a difficult exam, but you can get through it. Again, the resource I used was the Evolve 5th edition HESI Admission Assessment Exam. So good luck, and you got this.